Hello, everyone. Good evening. It's Mr. Alan Matus again. And for tonight, we're going to have our Facebook Live virtual coaching call for our students at Matus Nursing Review online NCLEX Academy. So for tonight, we'll be having some updates about the COVID situation. And also, we'll be discussing nursing, prioritization, and delegation as well. So we'll be having some sample questions as usual. And I would like to invite our enrollees to participate, give your rationale, and also put your answers, okay, in the comment section of this virtual call. Okay. So thank you very much, everyone. Let's proceed and have our first slide for tonight. Okay, so for tonight, we'll be discussing first the COVID-19 updates that we have for NCLEX-RN and also NCLEX-PN. As what we have discussed the last time for COVID-19 updates by the NCSPN, they said or they released information that the minimum number of questions that you will have will be 90 questions. Oh, no, sorry, 60 questions. And then your maximum number of test items will be 130 questions. So meaning that it's a big decrease in the number of questions that you usually answer for the NCLEX. Okay. The maximum testing time will be 4 hours. The original NCLEX-PN and NCLEX-RN exam usually has 5 or 6 hours. So they really reduce the time for graduates to take these examinations. Okay. Now, the most commonly asked question is the exam going to be much easier or is it going to be more difficult? Okay, so the answer to that question is that there's no change in the passing standard. It's going to be the same. It's not easier and it's not difficult. Okay, it's only the nature of the exam. Okay, it has been modified. That's the only change so far that that has been done. Okay, so one of the questions as well is, are the nurses gonna be able to wear PPEs during the examination, like your mask, for example, or the gloves, for example? Okay, especially the mask, definitely. Uh, so mask will be worn, but the only time that mask that will be removed during the examination will be during the I think during the fingerprinting or something, or the identification process, for the security of the examination. I think that is the only exception there. But throughout the exam, people will be wearing masks, or the examinees, and then at the same time you will be, or the examinees will be, several feet apart, or let's say 6 feet away, social distancing, which is mandated, to prevent the spread of the COVID virus. Okay, now the mask or the PPEs will not be provided during the examination. So if the examinee wants to wear a mask, then they have to wear a mask during the exam. Okay, so far this has these whole changes have occurred or started last March 25, and I guess it's going to go all the way to July 2020. Okay, and we're still waiting also for some updates from our government on what will be the practices that's going to be announced in terms of how we can control the epidemic. Okay, so stay safe, stay home, everyone, as we are trying to overcome this challenge that we have, which is the epidemic. Okay, so now let's have our first question. So let's first look at the comments. So we have the first person there. Hi, sir. I don't know really. I cannot see who it is, but it doesn't show. I forgot to put the link wherein you can show your face anyway. But if you answer, and you want, if I can show your answer in the Facebook Live, then you can put your name so that I could identify you. Okay, so let's proceed to our first question. Our first question is going to be, okay, all right. So the first question is all about delegation. So as usual, The focus of our Facebook Live usually will be delegation and prioritization. Well, Pratiksa, nice to see you here. Okay, nice to see you. So I'm putting you on the screen right now. Okay, so one of our students in the Matus Nursing Review Online NCLEX Academy is Pratiksa. Okay, thank you for joining us. So again, just a little bit of review of the delegation process. The most important thing is to always remember the three-letter S's, the three-letter S's of delegation. Okay, the three S's are the following. We have number one is the scope of practice. That's really very important. So if the RN or the LBN is delegating to the UAP or the RN is delegating to the LBN, the number one thing that should be remembered or factor to be considered is the scope of practice of that professional. Okay, so scope of practice. Okay, and then hi Fresel, how are you doing? Okay, scope of practice, and then we also have number two. We're gonna have the skill of the person. So it's important that the person that we're delegating the task has the skill. Is it an experienced nurse or is it a new graduate nurse? So those are the considerations that we need to remember when we are delegating the skill of the person. Okay, and of course, number three, another S is going to be the standard protocol. Okay, so when you're delegating, you have to check also the policy and procedure of your facility. That's really very important because at the end of the day, when you delegate, you have to look at the limitations imposed on the scope of practice of the staff that you are delegating to. Okay, so again, the three-letter S's are what are those? That would be the scope of practice, which is the most important one, and the scope of practice varies from state to state. So when you go to another state, you have to look at the Nurse Practice Act and you want to find out, make sure that you know the scope of practice in that state for the nursing professional. Another one is going to be the skill of the staff. And number three will be the standard protocol. Okay. And of course, lastly as well, if you want to add another S, that would be the supervision. Once you delegate, you still have to supervise. You have to make sure that you check the person, if the task that you're delegating is happening or not. If you're delegating and you're unable to supervise, then there's no point of delegation, because delegation does not mean that you're not responsible anymore. When you say delegation, you are still responsible, but you're just passing the task to another person, but you need to supervise. So in between, you have to find out, did the person understand the delegation instruction? Okay, you have to check if the delegation is happening or not. So for example, you have a UAP or CNA that you assigned or delegated to take care of a fall risk patient. Okay, after a few hours, you have to check the CNA or the UAP, if the fall prevention instruction is being followed, is it being done? Because at the end of the day, if this is not happening and you did not check, then you will still be liable for that. Okay, so thank you for joining us tonight. We have Pratixian, we also have Fresel. Thank you very much for being here tonight. Okay, all right. So let's have the first question, everyone. Okay, so this is going to It's going to be, okay, number or letter. Okay, that would be letter D. That would be the instructing the LPN to change the wound dressing of a client with a stage 4 pressure sore. Yes, very good, Pratiksa. Okay, so you got the right answer there is letter D. And what's the reason? Because an LVN is trained to change the wound dressing of a person with pressure sore. That's part of the practice, okay, to change the wound dressing. Unless the patient is unstable, then the RN has to do it herself. Now, letter A is wrong. Request the LVN to assess a client before giving a blood transfusion. Now, why is letter A wrong? Because you don't want the LVN to be the one assessing a patient, especially if you're talking a blood transfusion patient, because that's already an indication that that patient is unstable. Okay, so we have to add another S. The S now becomes not only 3, but becomes 5 now. The scope of practice, the skills, the standard protocol, your ability to supervise, and I think one of the most important ones is the last S is the patient stable? Okay? Because if the patient is stable, as much as possible, the RN or the LVN should not delegate that to the UAP, or the RN should not delegate that to the LVN. Okay? Now, letter B, asking the LPN to reposition the client. The LPN can reposition the patient, yes, of course. However, in delegation, you have to make sure that is that really the scope of practice of the LPN? Yes, it is. However, when you're delegating, you're doing it because you want to make sure that you are using the resources properly. You want the LVN to do something, a higher task, okay, like changing a wound dressing, but not turning the patient. Okay, unless there's an emergency, there's a shortage of staff, then there's nothing we can do. We have to change patients or we have to turn them. But if you have the right people and the right number of staff, then definitely the LPN, you may have to delegate the turning and repositioning to the UAP. Okay, and letter C is wrong because ask the UAP to check the blood pressure of a newly admitted stroke patient, and you don't want to do that because this is a newly admitted stroke patient and that patient is considered to be unstable. Okay, so the correct answer is letter D. Very good. Okay, so let's go now to the next question, everyone. Okay, so the next question that we have is now all about prioritization. So let's see if you are familiar with these questions about prioritization. Okay, now before we start, I would like to remind you the technique that I tell the students when I teach about prioritization. Always remember the 3-letter C's as well. Okay, the 3-letter C's, number 1 is what is the condition of the patient. Now, when you say condition, we are really looking at the severity of the condition. There are some conditions that are absolutely emergencies, okay, or absolute emergencies. For example, hypoglycemia. For example, myocardial infarction with chest pain. For example, what else? The emergency situations. As what I said, hypoglycemia and chest pain, for example. So those ones are non-negotiable, meaning they are really emergencies. Okay. Now, another C that you need to remember when you're delegating is going to be the C, which is it chronic or is it acute? Okay. When you say chronic, meaning that when you look at the situation, if it's part of the symptom, okay, especially chronic condition, then there's no need to be worried about that. Okay. However, if it is acute, meaning that it is more severe, okay, it is especially if it is unexpected. So that's going to be an unstable patient, so it either means that there's a complication going on, okay, or it's not part of a chronic condition, as what they have said. Okay. And the last letter C is, of course, you have to look at the clinical description. Okay. The clinical description is the one that changes everything. All right. Especially when you talk about time. So, for example, the clinical description is a patient who is newly admitted, a patient who had surgery a few hours ago, Okay, that means that that is an unstable patient. That's a clinical description. Or maybe another clinical description will be a patient who is about to be discharged. A patient who is about to be discharged or admitted a few weeks ago are more likely to be stable patients. Okay, so let's try to answer this question. Okay, the nurse is taking care of the following clients. Which client requires immediate intervention? A. The client with right-sided heart failure who has jugular vein distension. B. The client with diabetes insipidus with urine output of 80 ml per hour. C. The client with hyperparathyroidism who complains of muscle weakness. Or D. The client with a cervical spine cord injury who complains of severe throbbing headache. So why do you think is the answer letter D? Let's see. Okay, Pratisha said that the answer is letter D. Okay, if you have any other answer, let me know. Okay, maybe there is a better answer. Okay, so Pratisha said D. Okay, okay. The other people, what are you saying? What are the answers? Okay, so for this question, the answer is going to be okay. The question for this, the answer to this question is going to be, all right. Okay, let's see what's the answer. So in this question, you have prioritization. So letter A, let's analyze first. Okay, let's find out if letter D is the answer. So letter A, it says the client with right-sided heart failure who has jugular vein distension. That is expected, okay? Unless it says in the situation, the clinical description. Remember, I said the clinical description. Is it worsening? Is it new? Okay, then that means it is unstable. But A, okay, is part of the condition. Letter B, the client with diabetes insipidus with urine output of 80 ml per hour. Okay, is that going to be the answer? Again, remember, one of the C's in the prioritization is 80 ml per hour. That's kind of like expected from a patient with diabetes insipidus. Okay, it's part of the symptom. Unless you have additional description that will make the diabetes insipidus as an emergency patient. If you add, for example, with decreased level of consciousness, then that's a different story. Okay. Letter C, the client with hyperparathyroidism who complains of muscle weakness. And again, if you have to look at letter C, in hyperparathyroidism, what is high? You have high levels of calcium. And one of the effects of high levels of calcium will be muscle weakness. So that's kind of like expected again for letter C. Okay. Now, but letter D, you have to look at that. That is a client with cervical spine cord injury who complains of a severe throbbing headache. So everyone, what do you think is the condition that's happening in letter D? Why it is the possible answer? Because most of you answered letter D. MJ said letter D is the answer. So can you please justify what is the problem? And then if your rationale is correct, I'm going to flash it on the screen. Okay. So when you have a cervical spine cord injury, what is going on with your patient? What is one thing to be remembered again? Once you have a high spinal cord injury above T6 or thoracic 6, what complication are we looking at? Okay, what do you call that condition? We're in if the patient has a full bladder, if the patient, for example, has, or let's say bladder distension or fecal impaction or constipation, it causes severe sympathetic response. What do you call that condition among spinal cord injury patients? You call that what? You call that autonomic dysreflexia. So with letter D, it indicates autonomic dysreflexia. And that's what I told you, that in the NCLEX, you need to be familiar. You have to list down all of the emergency conditions because in the NCLEX, they're not going to give you autonomic dysreflexia. In the NCLEX, they're going to give you the signs and symptoms. So if you know the signs and symptoms of the condition, then you will know which one is a priority. Okay, so especially autonomic dysreflexia is characterized by severe throbbing headache, is characterized by bradycardia, for example, okay, and sweating, for example. Those are the other symptoms. And it is an emergency because the blood pressure is really very high. and that can lead to cerebrovascular accidents. Okay, cerebrovascular accident, okay, or stroke. So, all right. So someone said, okay, autonomic dysreflexia, very good. Okay, so T6 and above. All right. So T6 and above injury, yes, that's correct. And then if I'm going to ask you further, what is the first intervention if the patient has autonomic dysreflexia? Because letter D is the answer in this question. What is the first thing that you have to do? Okay, the blood pressure is really very high. You know, is it to check for bladder distension, or is it to elevate the head of your patient to sit up? Okay, what is the immediate goal that we have? Okay, Mars also said autonomic dysreflexia. Do you know that autonomic dysreflexia is a priority in the NCLEX? You should know that, right? And the priority intervention for autonomic dysreflexia is to lower down the blood pressure at least by elevating the head of your patient. Right? Then after which you can check if there's bladder distension or what are the other causes or triggers. And then lastly, what you can do as well with the doctor's order is to give the antihypertensive medication to lower down the blood pressure. Okay? So that's all about this question, everyone. The answer is letter D. Very good, everyone. Okay? Now let's go to the next question. Okay, so the same thing. This is another priority question. So I really encourage you to watch my videos in our last virtual coaching call, because I really focus all the time with delegation prioritization. It is a big chunk in your NCLEX. It is a big focus in your NCLEX examination on how to attack questions about prioritization and delegation. Okay, all right. So let's proceed. Our next question is another prioritization. Okay. So this is number 3, everyone. This is about which patient should be assessed first. So the nurse cares for the following clients in the medical surgical unit. Which client should the nurse assess first? A, the client who has gouty arthritis and reports severe toe pain. B, the client who underwent thyroidectomy who complains of sensation of pressure in the neck. Or C, the client with Cushing syndrome with hypernatremia and hypokalemia. Or D, the client with recent cast application complaining of warm sensation in the extremity. So what do you think is the answer to this question? Again, remember the 3 letter C's of prioritization. Okay, 1 is the condition. Okay, and 2, what is the uh, clinical description, and 3, is it chronic or acute? So find that out. Okay, so find out. So which one here is the most unstable patient? Okay, if you have the answer, you can put your answer, and if it is correct, I'm going to flash that on the screen, everyone. Okay, so let's proceed now to the answer. So in this situation, which one will you assess first? Is it the client who has gouty arthritis and severe toe pain is being reported? Of course, letter A, that is part of the condition, the toe pain. You want to address that, but I don't think that if you have 4 patients here, this is a person you have to address right away. Okay, so you really have to look at the 4 situations. Okay, now letter B, the client who underwent thyroidectomy who complains of sensation of pressure in the neck. Okay, so letter B is thyroidectomy, and usually when you say thyroidectomy, bleeding is the #1 complication of that. And the question is a sensation of pressure in the neck an indication that bleeding or hematoma is happening? Okay, and letter C, the client with Cushing syndrome. Now remember letter C, that Cushing syndrome, that is an expected electrolyte imbalance in Cushing syndrome. You have high sodium, and then you have low potassium in your Cushing syndrome. So that is expected. Unless the lab values are critical, very critically low or very, very high sodium, then that becomes an emergency. Okay. And letter D, the client with recent cast application complaining of warm sensation in the extremity. Is that the answer? Letter D, warm sensation after cast application? No, because that warm sensation in the extremity, especially if you're using a plaster of Paris for cast application, that is expected. So A, B, and no, A, C, and D are kind of like expected, symptoms out of the condition. You don't report them. So the answer is going to be letter what? A, B, C, or D. So Mars said letter what? Letter B. Okay, and the correct answer is actually letter B. So congratulations, Mars. B is the answer. And why is B the answer? Because signs of bleeding after thyroidectomy when you're studying, very important. A pressure of sensation, and also, of course, one of them is stridor. Stridor is the presence of a high-pitched sound that indicates respiratory obstruction in patients after thyroidectomy, which is bleeding. And that's why it's very important after thyroidectomy that you have to teach the patient on how to properly support the head and the neck when changing positions, okay? Because you don't want to put strain on the suture line that can cause a person to have bleeding. So the answer is going to be letter what? Letter B. Congratulations, Mars. Another one, we have B from Myra. So Myra is one of our students right now as well in the online NCLEX Academy as well. So good. So we're learning a little bit with this delegation prioritization question. So the answer is letter B. Okay, so let's have number 4 question. Okay, so number 4 question will be about, so this is also about prioritization. Okay, so let's answer the question. The unlicensed assisted personnel, or UAP, reports to the charge nurse that the client who recently underwent adrenalectomy has the following vital signs. The blood pressure is 90/70, the respiration is 22, and the heart rate is 110. Which of the following is the priority nursing action? Is it A, report the findings to the physician, B, assess the client and the wound site, C, initiate fluid resuscitation, or D, call the rapid response team? There is a very good reason why I chose this question for today, because I'm going to be discussing with you one of the key principles when you're answering prioritization questions. So can you please put your answers, everyone? What do you think is your answer, A, B, C, or D in this situation? So let's analyze the question. Okay, so in this situation, you have the UAP reporting vital signs to the charge nurse of a client who recently underwent adrenalectomy. Okay, and you can see in the vital signs, you really have to look at the situation and look at every number, the vital signs. Like your blood pressure, for example, is 90/70. That means that it is low. Your respiration is 22, and the heart rate is 110. And these 3 values actually mean that you have a patient who may be developing what condition? This patient may be having what? Shock, okay? Or hypovolemic shock due to bleeding. So what is going to be done by the nurse first? Okay, reporting the findings. Is it A, B, C, or D? I would say that in the NCLEX, always remember that reporting is the last resort, okay? It is not always the best answer, because the NCLEX would like to find out if you're going to be a nurse who will do something first to the patient before you report. So before you pick that answer, which is report, you have to think twice, because usually in the NCLEX, that may not be the answer. You have to look at the other questions or the other options. Letter B, assess the client and the wound site. Okay, yes, of course, you have to do that, because you want to check first what's going on with your patient. Letter C is not correct, because it says initiate fluid resuscitation, which is an intervention. Okay. And letter D, call the rapid response team. So you don't really have the whole picture here in the situation. You don't really know right away if the patient is in distress. So the first thing you can do here is to assess the client and the wound site first. You want to see what's going on. And then after that, you can decide if you want to intervene or not. Okay, so the answer to this question is going to be, letter B, assess the client and the wound site. You want to check the patient first. Okay, the only time that you don't assess the patient is if the patient is in front of you and this patient is in distress, for example, and the patient cannot breathe. Then what you have to do is you elevate the head of your patient and you give oxygen. So remember this principle. If a patient is in front of you and the patient is in distress, you have to intervene right away. Okay, because you know you don't need to do assessment anymore, because you know your patient is in distress, elevating the head, giving oxygen, or any other measures related to the problem. However, if you don't have the complete information about the patient, especially in this situation, then you have to confirm what's going on first by assessing the patient and the wound site, because there might be bleeding that is going on in the situation. All right, so be very careful with answering assessment, and be very careful with answering intervention. If the client is in severe distress and you're very sure of it, you're seeing the client, you're looking at him, then that's when you really have to intervene right away. Okay? No need for assessment. So the answer for this is going to be letter B. Very good. So we also have Mars. Mars also got it right. He said also letter B. Okay. And then also Myra said letter B as well. Okay. So B first. Okay. So now let's go to the last question for tonight. Okay. I really want to have a lot of questions for our Facebook Live. However, I think 5 questions is enough. It's the principles that we are learning that is really important. Okay. And we're planning to do more of this, as much as possible. And thanks for joining me as well. And I hope that you're learning something for tonight. So the last one is about prioritization again. Okay. So prioritization again. So here is the question. A medical surgical nurse is receiving end of shift report from the night nurse. Which of the following clients needs to be seen first during rounds? A. The client with pheochromocytoma who has a blood pressure of 140/100. B. The client with diabetes mellitus complaining of severe thirst. C. The client with basilar skull fracture who has clear fluid draining from the nose. Or D. The client with ankylosing spondylitis complaining of severe neck pain. Okay, so what do you think is the answer? Okay, so which patient needs to be seen first? If you have this question right in front of you in the NCLEX, what will be your answer? Okay, so let's dissect the question, everyone. Okay, so this is about prioritization. So someone said it's going to be letter C. Okay, that's one. MJ is one of our students as well in the online NCLEX Academy, and she said letter C. Thank you, MJ. Another one. Okay, so Pratixa said it's CSF that is leaking, so that's why letter C is the answer. Okay, and then another one again, Myra said also letter C. So this is a fairly easy question. Okay, so which client needs to be seen first? Letter A. So, but you have a patient who has pheochromocytoma. First, you have to know what is pheochromocytoma. That's in my book. My book is published in Amazon, and pheochromocytoma is a condition that is characterized by increased blood pressure, and that's 140/100. It's part of the symptom. You may want to attend to that, but the question is that really the priority, the 140/100? Can that wait a little bit? Because you have to look at the other patients. And for letter A, hypertension is part of having pheochromocytoma because of the release of catecholamines due to a adrenomedulla tumor. Okay. Letter B, the client with diabetes complaining of severe thirst. Yes, maybe something is going on, but remember that in diabetes, again, it's part of the chronic condition, especially if you have high blood sugar. So B could be concerning, because maybe the blood sugar is high. However, you have to look at the most important, the most unstable patient. And letter D, you look at letter D, it's ankylosing spondylitis, which is the inflammation of the spine, complaining of severe neck pain, which is part of the symptom again. So if you have to look at A, B, and D, these are symptoms part of the condition. Okay? So the answer is going to be letter what? Going to be letter C. Very good. How do you check for CSF leakage, everyone? Can you tell me again? How do you check for CSF leakage? Okay? So CSF leakage or CSF that is draining is checked. How do we know it is CSF? Is by getting a gauze dressing and then applying that on the area, and then you can have you will see a halo sign. Okay, and then another one is to check the fluid for glucose. So those are the two things And remember that when there's a CSF leakage, okay, or CSF leak, that is an emergency, okay? An emergency because it means to say that maybe there is increasing intracranial pressure that can lead to brainstem herniation, okay? Or, of course, one of the concerns as well with CSF leakage is the possibility of infection, okay, of the nervous system. So it is an emergency. It is a serious situation when CSF is leaking because that indicates that there is severe damage to the nervous system or to the skull of the patient or the head injury, okay? And you have to report that to the physician. Okay, very good, guys, for answering that. Okay, so all right. So those are the 5 questions that we have for tonight. Our next live will be in the next 2 weeks. However, if we have an opportunity, we'll have more of these sessions maybe next week or the other every other day maybe. We'll find out, but then we'll have questions and we'll practice more about delegation and prioritization. Okay? And before I end, I would just like to make an announcement that we have started a new program in our online NCLEX Academy. We have a 10-week ongoing fast-track live NCLEX review, meaning that you can enroll anytime in this program. There's 10 modules. You can start anywhere, and it's fast-track, and it's very important that you watch the video and complete the workbook, meaning that you come to the class highly prepared because it is fast-track. You need to make sure that you have the information, okay? Now, another one is because of the COVID situation, we are going to have our 8-day live webinar, which is from 8 to 4 p.m., I guess. Okay. It's a whole day event every Saturday for 8 days starting May 9. Okay. That's our NCLEX webinar. So we have the 10-week fast track, which happens every Tuesday from 7 to 10:30, and that's a fast track NCLEX review. And then we have the 8-day that is going to start in May 9. Okay, so if you want to sign up, just visit our website, which is Matus Nursing Review Academy.com. Okay, Matus Nursing Review Academy.com. All right. So thank you very much, everyone. If you don't have any questions anymore, okay, we have to end the night. And thank you very much for participating. Always feel free to email me at info@matusnursingreview.com. And also, just to let you know, I have a published book in Amazon. Okay, it is titled Simple, Fast, and Easy NCLEX Review Book. And a lot of students really like that book because it is simple and direct to the point. So hopefully for tonight, you were able to learn something. And then if you encounter these kinds of questions in your NCLEX, you'll be able to pass your licensure examination. Okay, so don't be afraid of delegation and prioritization questions. That's the focus of our discussion for tonight. And thank you, Hazel. Thank you, Fresil. These are my students, and they're also part of our Facebook group. And our students are very active in the Facebook groups. They receive questions every day, and then they also rationalize. We discuss the answers, and that's how you prepare for the NCLEX. You need to know your content, and at the same time, you need to make sure that you develop and improve your test-taking practice skills. Okay, so thank you very much, everyone, and have a good night. Okay, so see you all in our NCLEX review webinar. Thank you.